I'm Dr. Cameron Noble Carmody. I'm a spine surgeon here at Plano Orthopedics. I've been practicing in spine surgery for the last 20 years, and I'm board certified in orthopedic surgery. I have maintained my board certifications, and they are current. I went to college, University of California Irvine, and went to medical school at UC-Irvine, did a fellowship in Florida, in Gainesville, and have been practicing orthopedic and spine surgery since then. I found that jobs that you could learn, skills that you could learn quickly usually became very boring. I wanted to spend my life doing something I enjoyed doing. That's why I ended up going into medicine. I started focusing completely on spine surgery 15 years ago, but I try to do everything in the spine. So anything from the base of the skull all the way down to the pelvis is territory that I'm familiar with. Anything from a herniated disc to stenosis to fusions to deformity surgery and everything in between. I think all surgeries should be minimally invasive. However, that's with a caveat. They also have to be maximally effective. And there are a lot of times they're trying to do the minimum amount of invasiveness limits your ability to achieve the goals of surgery. And so what you really want rather than minimally invasive surgery is maximally effective surgery. And that's what I believe in. Recovery time after surgery is based on how bad the pathology is and what needs to be done to fix it. Sometimes the recovery is immediate. Pain goes away and they feel great because they were in so much pain to begin with. If you remove that pain, they feel great in comparison. Sometimes the incisions are very small and don't require a whole lot of healing time, and people get back to stuff very quickly, particularly neck surgeries. Other times it requires some healing and some time off work and some medications to get through the rough spots until everything heals and gets better. Technology is advancing such that it's allowing us to do a better job of achieving good clinical outcomes simply by coming up with better ways to fix things. One of those things is 3D printing and of complicated geometries that act more like bone than other implants do. And so if you are replacing a joint, trying to achieve a fusion between two bones, it's best that whatever device that is feels like bone to the adjacent bone. Because if that's the case and you can hold it together and keep it from moving, then bone is more likely to fill that space just because it feels like bone already. And what I mean by that is the mechanical characteristics of the device. It has the same modulus of elasticity and stress and strain curves, and it has a congruent surface area so it doesn't have areas of point loading. Those are the kind of things that we can do now with 3D printing that make fusion of the spine a much more reliable process. It feels like an honor to be recognized, because I know that very few are recognized for this. I think that the key to helping people is understanding their problem. And an old mentor of mine once said in a humorous way, if you let the patients talk to you long enough, they'll tell you what's wrong. And it seems simple, but it's actually true. You got to listen to where they're having symptoms, and then you have to examine them and try to understand and make sure that you understand where their symptoms are coming from. And then you have to test some of those ideas. You can't just jump to the conclusion that it's there based on an MRI finding or anything yet. It all has to come together like a puzzle.